we're going to jump in right now and get started. Again, my name is Sheela Roth. I am Head of Clinical Education here at Pearl, and really thankful you chose to spend your evening with us. When we think about growth in dentistry, it's easy to get caught up in marketing, production, those kinds of daily goals. But let me ask you this. When was the last time your patient said yes to treatment simply because of a sales script, right? More often than not, what actually moves the needle is trust. And your patients trust you. Trust in the team, trust in the doctor, and trust in the care they're receiving. And that's exactly what tonight's session is all about, how we can pair that human connection with modern technology to create exponential, scalable growth in our practices. When we think about case acceptance and we think about what our patients see compared to what we show them on a radiograph, there's a big disconnect there. I'm honored, to introduce our speaker, Dr. Jennifer Derse. After graduating from Marquette University School of Dentistry, she built her career around restorative and cosmetic dentistry, first in Scottsdale, then in Denver, changing thousands of smiles across the country and internationally. Today, she serves as the Chief Clinical Director of Aspire Dental, where she mentors doctors, guides patients' experience, and leads clinical growth across multiple practices. She's also a mentor at Coy Center, has lectured internationally on cosmetics, restorative dentistry, aligner, case acceptance. I can't even keep going here, Dr. Derse. Continues to raise the bar on leadership and hospitality and dentistry. Beyond the practice, she's passionate about being involved in her community, launching. Tell me about this foundation tonight. We want to hear about this foundation to expand access to care and support local nonprofits. So you're going to get into that. She brings a combination of clinical excellence, leadership insight, and people-first philosophy. Today, she'll share the blueprint on how empathy, clarity, and technology can unlock new levels of patient trust. And that's really the foundation of overall scalable growth. Without further ado, Jennifer, thank you so much for being here.
Thank you so much for having me. And thank you all who are watching this evening for investing your time and energy after work into yourself and your practice. It really is a pleasure to be with all of you, and hopefully you'll find this next hour to be inspiring and full of opportunity for your practice. My favorite thing to show, besides like the awesome, cool cases that we get to do, is really our failures. And after 20 years and I've done a lot of Botox, 20 years in this field, and especially the last 5 as the chief clinical director, and where you get to see so much more of what everybody's doing, it's been great to see the good, bad, and the ugly. But failure, like the bad and the ugly, it just sucks to experience. But if we didn't have these situations, sometimes we wouldn't learn and grow if we didn't have something that felt uncomfortable. So hopefully you can sit back, relax, have some wine, beer, or a soda. I know, really corny, and learn some pearls for your practice this evening. We'll get this techno party started.
Love that. So, and sorry, I was going to just jump in one more time real quick. People are asking questions about if this is going to be recorded because they want to share this with their team. So I want to make sure everybody does know this will be recorded. Your CEs will be at the end. And a special thank you and shout out to the SOTA team for joining us this evening. We're partners with them. And we also will be hearing from the Director of Sales, Dr. Scott Cote. So we look forward to seeing you at the very end.
Thank you for that.
I'm not a doctor, but I appreciate the intro, and I'll appreciate the opportunity to be here this evening.
Yeah.
Thanks.
Well, you all are what makes evenings like this possible. And so, after you experience this webinar, if you haven't gotten to connect with these partners this evening with SOTA and Pearl, please find a way to, I don't know, Sheela will tell you how to do it, but connect with them afterwards and do a lunch and learn, or do something, explore it more. I highly encourage you to do that. All right, giddy up, let's go for the evening. All right, so agenda for tonight. We want to build our exams in a way that's going to boost our patient confidence. We're going to use technology as a translation tool. And we're also going to include our teams in this process. This evening is designed to be for the entire team. It's not just doctor only. It's for everybody. It's for hygiene. It's for assistants. And even, on your business team, you're going to want to understand how to use these x-rays, whether it's for insurance reimbursements or, we all know that even if you're, not on the clinical side in the back, patients will still come up to the front and ask you for more clarification. Hopefully not. Hopefully your clinical team has gotten it all covered, but it's important for us to all understand and know. And before we get started, we have to have these disclosures and disclaimers for you to be able to get CE. So full disclosure, I am the Chief Clinical Officer and an owner at Aspire Dental. I do not have any financial interests in our partners this evening. The commercial support for this program is being delivered by SOTA and Pearl. All the clinical procedures, methodologies, participants, you can read this all. It's pretty much there. I won't waste time on it, but screenshot it if you need to dive into it more. All right. What's the common theme? If you look at these 4 photos, ask yourself, because, it's not all that you got Matthew McConaughey. It's not that everybody's really attractive because you've got the used car salesman who's not. What is everybody doing? You've got Matthew McConaughey in a movie persuading a jury. You have the used car salesman trying to get you to buy an old car. You have a teacher teaching math to elementary students, and you have a personal trainer. You've got to think, oh, Jen's got to be really ADHD, and full disclosure, I am. So I look at all of these and I see that there's a common theme. All of these people are trying to persuade another human something. And whether they're persuading the jury, they're persuading a sale, they're persuading fitness, they're persuading the brain growth of math, they're all persuading something. And when we talk about what we do in and out every day, there's this discomfort that people sometimes share where they say, I don't want to be a salesperson. I don't want to sell dentistry. But if you really look at the definition by the Oxford Languages Dictionary, selling means to persuade someone the merits of. So before we get started, if some of the things that I share with you feel like they might be a selling tactic, it's really a tactic to help you persuade somebody with the merits of whether it's diagnosing or treatment. It's to help you in that process. And persuading somebody to do something to take care of their bodies and their health is a great thing. Let's start with our patients' brains and our brains. When you think of the mind, and I give you a mental image, like a flying pigs, what do you see? Do you see the words flying pigs? Unlikely. You're probably seeing like pink pigs in the sky with clouds, and if they're flying, maybe they have wings, and they're probably smiling pigs because why, they probably think that's really fun. Unlikely you would ever see that word written out. So in dentistry, we have to understand the neuroscience and how our brains are hardwired for our patients to give emotions the upper hand. And everything you see, smell, hear, taste, all your 5 senses travel through your brain, and they enter your brain through the spinal cord. And as they enter your brain through the spinal cord, they have to travel to get to the frontal lobe. But in order to get to the frontal lobe, they have to pass through the limbic system, where your amygdala is. Now think about amygdala, your limbic system. I feel like the word amygdala, I can't even say it. It sounds like a lizard, or it sounds like a dinosaur. So you know that is your core fight or flight brain. And that is also where your emotions are produced. The rational area of your brain, your cortex, way over there on the right side of the screen, is where you have your logic, and your signals can't get to your cortex without passing through the feeling system, the limbic system. It's your fight or flight state. And if you really think about our patients, patients come in most likely in a state with elevated cortisol, which puts us in that fight or flight state. It's how we've survived as humans. And they come into our practice in that space, and getting to their cortex requires effort and intentionality, especially when you're in that limbic dinosaur brain. So our job is to help get our patients into their cortex, right? And help them get out of fight or flight and into their cortex. Patients also don't buy a solution to a problem they don't perceive themselves to have. Think about periodontal disease. I'm going to show you an example with my mother-in-law who had a periodontal issue, but it never hurt. She didn't feel it. And how many times have we seen that with patients who suffer some type of bone loss and they never know it's there? So why would they move forward with care if they don't understand it? And why are we here all together tonight? Well, my hope for you, and hopefully for yourself, is that at least one of the pearls you get today helps you with case acceptance. And if you think about how 40% of most jobs are spent convincing and influencing others, all of you are in that space, convincing and helping others. So how are we going to do it? I'm going to say the why, but let's talk about the how. Let's get this information that you are selling health when we achieve case acceptance, and create an opportunity for you to really care for your patients while also, fortunately, growing your practice. How are we going to do this? The first thing we need to do to get our patients out of that limbic system and is to get them into this space of psychological safety. Now, patients need to believe that they are equal in the conversation. That's a really important part of psychological safety. To me, when I was practicing, I almost wanted to have my patients feel like they were a little bit more the expert. Like, even if before we get down to talking about, the dentistry itself, I want them to feel like they're an expert. Like, tell me about your career. Tell me, that sounds so fascinating. I want to learn more about that, because I'm taking them out of that fight or flight state into their cortex where they're feeling confident and intelligent and sharing something with me. Then I also want to make sure they do not feel penalized or judged. We want to validate some of the good things that are going on in our patients' mouths. I like to use the analogy of a forensic accountant, because sometimes we go in just like a wrecking ball, like Miley Cyrus, and we're looking for everything that's wrong. That's our job. That's what a forensic accountant does. However, if you come in like that wrecking ball, sometimes our patients will feel judged. I have seen enough reviews. We have a product that called Bird Eye that gives me the reviews of every practice. And whenever the review is 7 or less, I get the email. And I will tell you, there are times when a patient writes, I felt like the hygienist was judging me for not flossing. Whatever. They want to feel like they're a part of it, and you're pacing together. So you want to start to explain once you get them curious. I'm going to talk to you a little bit about how to do that. You cannot create a feeling of safety, but you can be mindful of the behaviors. Be mindful of, maybe your patient's disc default communication styles. Maybe be mindful of their body language. There's so much that goes into this, but you want to be really intentional. And remember, you're doing this 10,000 times a month, a year, 1,000 times a day. And the human being that's attached to the smile and the teeth, they have not. I can't tell you how many times I've shown a patient x-rays and say, what do you see here? And this is back before we had Pearl. What do you see here? And they'd look at their FMX and they go, I see toes. Or I'd show them their smile and, like, tell me what you see. And they're like, well, I need to wax my lip. Like, the way they perceive what we're looking at isn't always the same. And it's rarely the same as ours. So we have to remember that we are in the supportive role where we want to engage our patients more than educate them. We want to partner with them more than parenting them. And we can use technology to bring them into the conversation rather than confuse or overwhelm them. Because if you start using big terms and technology and you're pointing at this grayscale that nobody understands and they think the tooth looks like a toe, like, that's not going to get you anywhere. So let's learn how we're going to bring them into this conversation. And this is off of the technology beat, but I before we go high tech, I want to go old school, a little analog. I can't harp anymore how important it is to call your patients before they come in for their first visit. Also, I'm a big advocate of post-treatment calls for everything, not just your extractions, but anything down to just an occlusal composite. This human connection and empathy and compassion immediately increases your patient's perception of your hospitality, your care, and increases their trust. I'm going to give you this verbiage. I used it for years. And, you know, every new patient that came into my practice always got a new call from me. And I'd call and say, hi, this is Dr. Jen. I'm so excited to meet you. I want to give you an opportunity to have any questions or concerns answered before your first visit with us. You can expect a thorough exam tomorrow, and we're going to take as much time as you need to have all of your questions answered. If there's anything I can do to help you feel more comfortable before your visit here, please feel free to call me, 303-333-2221. I'm looking forward to meeting you and helping you achieve your SMILE goals. Now, imagine, put yourself as a patient. Imagine if you're going to go see a spine surgeon, and it's scary to go see a spine surgeon, and don't ask me how I know, but imagine if they call you to welcome you to their practice and reassure you that everything's going to be okay and that they're there for you. Imagine what that would feel like for you. And now imagine how much that can increase rapport for you before your patient even comes in. And most of the time, they don't answer. So you just leave a message. And if you do get them and you get the like high, high energy patient who wants to connect, well, now you know they're going to show up. If they talk to you for 15 minutes, and that's happened, but if you call them, they talk to you for 15 minutes, you know they're showing up for their appointment, and you know they're going to accept care. So within these first moments, it's so important. People judge you within 5 seconds of meeting you, and they also will determine, fun fact, if they can trust you within 1/10 of a second. I'll tell you, I met another dentist this summer at a conference, and I met this dentist for less than 1 minute, and I was immediately turned off by their behavioral interactions. So I judged that person pretty quickly. Now think about what our patients are doing with us, and they're scanning for safety, and they're scanning for anything that could be wrong. So this is really important that before you dive into your technology, you want to form that relationship, and then you get to triangulate the technology into the picture. So how do we do this? Let's get in here. Let's have a verbal knee to knee, heart to heart, eye-to-eye conversation with your patients. Make sure you make eye contact. If you are not so comfortable with that, I recently saw a reel from Esther Perel, who's a psychologist on Instagram, and she's an interesting person to follow. But she talked about how if you're in the younger generation where you've grown up more on devices and random conversations don't feel as comfortable with you, she recommends going through this exercise of getting in an elevator and talking to strangers. And the more you do it, the more comfortable you're going to become with having random conversation. Next, you're going to make sure, like when your patient comes in, I want you to go out to where they're seated. Do not, teammates, call their name from the door and yell out, Sarah. That's not personal. It's not a warm touch. If the patient is probably already checked in with one of your front office teammates. So ask who that is, and then go up to them and go right to where they are. Introduce yourself to the patient and say hello. Offer them a tour of your practice. It's your home. If somebody comes into your home, you might say, okay, I'm going to throw your coat in the spare bedroom. The bathroom's right there if you need anything. Like if you have a guest staying with you, help yourself to the fridge. Like we make people feel comfortable in our homes. Let's make them feel comfortable in our practices. I like to break the ice immediately with conversation. One of the words I use or phrases I ask is, what is the highlight of your day today? And I would ask, if this was a live audience, I'd ask you why, but why am I asking you what the highlight of your day is? The reason I'm asking your highlight is I want to take your brain scanning for something positive. And you're in my practice and you're already scanning and going, oh, I had a great walk with my dog this morning. So now you're having this little dopamine release and you're sitting in the dental chair. So there is psychology to that. I made it up, but I think it's real. Then you're going to graduate into your dental history interview. And this is really, really, really important. When you have this conversation around the paperwork and focus on your yes answers. If there's no, don't go through the no's because that's just frustrating. But anything they say yes to, ask for clarity. Tell me more about that. This is your opportunity to acknowledge all the information they provided. And I have seen in chart audits a huge opportunity when you have that conversation. I'll read a dental history review and see that somebody wanted aligner therapy. That's what they came in for, and the doctor never talked about that. What a missed opportunity. And they might think, oh, you don't do this, and they're going to go somewhere else. You know, we don't have to have time to totally dive into that process today, but I want you to know it's a big asset in your treatment planning and case acceptance armamentarium. So if you skip this vital step, this is how they will perceive the effort of filling it out.
I like my doctor. The one thing that drives me crazy, every time I go, I have to fill the same form out. And I'm like, what are y'all doing with this form? Last time I said, let me take it home. I'll take it. I don't know if y'all have a fire here every night. I don't know any of the answers, and they're about my body. I have to call my wife and go through them. I'm like, have I had surgery before? They always ask what your family medical history is. Where am I finding that out? You think I'm just at home at Christmas? I'm like, all right, who's got diabetes? Come on now, got a physical coming up. How many heart attacks we got in the room?
He's great. So if you avoid that paperwork and that conversation around their dental history, remember you're a dentist, you've got to acknowledge dental history. You're missing out. And also your patients lose trust if you don't go through that. You gain trust. It's a win-lose. You're either going to win them over or you're going to lose them. So, you know, we're focusing on the radiographic concepts today and the patient documentation and case acceptance, but your checklist absolutely needs to review the medical and dental history, recording vitals, taking extra oral photographs. I will touch on that briefly, but I like to take a DSLR photo, or if you're not comfortable with DSLR photo, there's a product that Shofu has that's a camera, and you can just take your smile, your arch, a bite picture, and a face photo. And these are really helpful for patient conversations. Additionally, your full mouth series of radiographs. I am going to point out why I think that is vital to your exam. Obviously, intraoral photos. You're charting your existing dentition, that all needs to be charted. Complete periodontal charting also needs to be charted on any comprehensive exam. You have to do this. I see a lot of missed diagnosis for periodontal disease. And the good thing about having AI is that, well, I'll show you those metrics later. So FMX at every new patient exam, and then every 3 to 5 years thereafter, depending on the patient's risk. You also want to be taking bite wings annually, and then including 2 to 3 anterior PAs. Just know that if you do bill 3 PAs, you might want to write off one of them if the patient is an insurance patient, or just in general, like make that your always, because an insurance company will default to an FMX if you take 3 PAs with the bite wings. So we will code out 2 PAs for that. But this is really, really key. And then also make sure, one of the things that I learned from John Quace like 20 years ago is take time, slow down, and look at the x-rays in front of your patient. It adds show quality. If you only look at them in your back office and you come out in front of them and don't like look at them in front of the patients, They may think that you didn't actually look at them. I think about every time I talked to a spine surgeon, they brought up my MRIs and they went over it with me. And that's really important. But I know what you're thinking. You're thinking here, well, all right, I want to do the FMX and I want to do these annual x-rays, but what if they say no to x-rays? Ask yourself first, what if the patient, are you having approval addiction? Approval addiction is this condition where you don't feel comfortable with a person saying no. And sometimes we get uncomfortable around patients who are like, oh, I don't want x-rays. So we want to learn to ask questions rather than jump to an immediate answer, get defensive. Well, I have to take x-rays, because your patient might not be fully informed on x-rays. So don't give up right away. Ask questions. If the patient says, I don't want x-rays, well, before I go anywhere, I'm going to say, tell me more about that. I want to understand what, I want you to feel heard, and tell me why you don't want x-rays today. Do you understand the purpose of x-rays? And, you know, like, I want to know why. I tell you, maybe share a personal story or one of the cases I'll show you today. I don't care if you screenshot one of these and share it with somebody. You know, and then this final question, if you have something wrong, do you want to know about it and fix it? Because it's really tough for someone to say no to that. Like, you're here, and once you have an awareness, like I'll tell my patient, let's look through all of this and let's have an awareness of what's going on so we can collaborate and decide together what pace you want to do treatment. It's up to me to give you all of the information, and then we can decide together what pace we're going to play at. Another one, this is really straightforward, but most patients don't understand that nowadays there's very little exposure. We aren't even required to wear the apron anymore, and you can offer that you know, data and still offer to use the apron, but ask them, are you open to hearing some updated information on x-rays? The word open is super key because people want to be considered open-minded. So use that word open in so many situations. You'll hear me say that in just about any opportunity I have to teach. And share with them, you know, we've invested in these state-of-the-art digital x-rays. There's less radiation than you standing outside in the sun, microwaves, flying, any of it. So if it gives you peace of mind, I'm happy to put a lead apron on, and we're going to only take the necessary x-rays. FMX necessary. I can't afford them. Now, this isn't something I wouldn't offer them complimentary at the initial exam, because then I'd be really concerned about the patients not being able to even move forward with treatment. But if this comes up at a recare visit, I do sometimes create an opportunity for them at no cost, because it's been a long time loyal patient. But when you're having this conversation with a new patient, I can't afford them. I know you're here because you are proactive about taking care of your health. I'm curious, is that still the case? Because I'm concerned if we omit these and they help me to see what my eyes can't, like, we can move forward and we can work together to prevent larger treatment, and that could potentially add more cost. And if you're concerned about affordability, it could actually backfire on you. And then, you know, we've got stories to share about it. So everyone deserves an FMX. And I say the word deserves an FMX because I really do believe they deserve that time rather than just tossing a pano at them. And I know, and if you want to add a pano in, I don't care, but that FMX provides you so much more clarity and detail. And I've seen enough missed on the doctors that only take panos. Like, this is an example from a doctor that is no longer part of our team. And, you know, this is the chart notes. And he talks about that there's a missing restoration on number 30, so they're going to place crown. Well, what happens next? You know, I'm going to zoom in on this for you. Oh, actually, I'm sorry. I was moving on to the next patient. I want you to look at this closer. And if you can on your screen, I'll pause for a second, zoom in. When the patient came back in to get the PA that's necessary for the insurance coverage, they then saw the abscess that was on that mesial root of number 30. So they missed the abscess at the comprehensive exam and then saw it later at the treatment. So they had to abort treatment. They then had to switch to an extraction and bone graft referral versus doing the crown that was scheduled. And the patient was pretty upset. They actually left the practice. This is another one of a doctor that's no longer with us. And this doctor was adamant about just taking panos. This is what they felt like for their radiation and exposure and for them to see everything. But what happens next in this story is that the patient came back with some discomfort and 2 weeks later, and this was not noted at the new patient exam. I want to be clear that the doctors that I'm showing you are all licensed providers. There's also hygienists in here that missed some of this, and some of them had 2 years of experience, some had 10, some had 30. We all think that we are going to catch everything, and that's not always the case. So please pay attention to this. Here, I'm showing you my mother-in-law, and this is pretty frustrating because she went and saw a dentist in her hometown, and I asked her, she saw a new dentist because her insurance changed, and turns out she's going to lose some teeth. And she sends me her x-rays and she says, Jen, I want you to take a look at these. I'm not understanding why I'm suddenly experiencing periodontal disease. So she gets the x-rays and she forwards them to me, and they tell her, well, yep, we've got your pano and here's your bite wings. So bite wings are not a chopped up pano. And you can see the lesion there on the distal of number 3 and the mesial of number 30. You don't see it as well as what the next dentist took with actual PAs. Look at the clarity there. And you can see why she's really, really upset. So I know more often patients are undertreated than overtreated. And I hear doctors say all the time, well, I'm conservative, I'm not going to overtreat. When you tell me that, I'm actually a little worried that you're going to miss something. If you think about 43% of periapical radiolucencies on x-rays are undiagnosed, and 49% of caries are undiagnosed. If we rely on our naked eye for radiographs, and for some of you, AI, like, think about, you're looking at grayscale. Our brains aren't even designed to read the amount of grayscale that a computer can and the AI can. So I'm going to keep showing you some of these examples because I really want this to hit home. Like, here's an example of another patient that was being undertreated in a practice with 2 really experienced doctors and an experienced hygienist. And if you look like at what my image is here, that this is all screenshotted right out of SOTA. You can see that this, was taken on February of 2024, and the doctor and hygienist both saw this patient. Now, I want to share with you, when I log into my software in SOTA, it defaults me as the Riverfront location. So I don't want you to look up my Riverfront doctors and say, oh my gosh, you're missing stuff. They're great doctors. It's not necessarily Riverfront. Okay. But let's zoom in on those pictures I wanted to show you. We can click on any picture when we've got this, and there's the little dots that show up saying like there's the calculus or decay, but Pearl says there's a lesion, so we open it up, and both the doctor and the hygienist missed that lesion. It was decay under number 4 and number 28. And what you can see in the smaller picture there is I highlighted with the arrows so you can see, when you turn off the AI, it's there. And this patient went a full year, and then the second time the doctor saw them again, they didn't, they missed it a second time. So if they would have looked at the dots, they would have been cued to open it up and pay attention to what to look at, and Pearl highlights it. It's also highlighting not only the caries under the crowns, but also any notable margins, and you get to decide if you want to keep an eye on that overhang, or if you think, oh, maybe that's just calc and or cement and I want to clean it up. You decide, but it's going to highlight it to bring your attention to it. So let's go to another example. This one had a few opportunities that were missed. You can see all the little dots that are on there. So this opportunity, if you looked at the radiograph just on its own, I would have missed this. I know I would have said, okay, cool, really nothing to look at here. Just looks like some lower incisors doing their thing. But then when we turn on the Pearl, it highlights that there's maybe some bone loss and some calculus. And the calculus is hard to see. Like, maybe you can zoom in and see it. But what then I did do is I inverted the image and then used the tools on the right to zoom in so I could add the little green arrows. And that way I can screenshot that for my patient and for the insurance company to see. And my RCM team or admin team can now have that image to submit in addition to charting the bone loss and the measurements to the insurance companies along with your intraoral photos. So remember, they don't want to pay you. The data that I saw in our UHC claims is almost 50% denials on the first claim. They are trying not to pay you. So the more evidence you provide, the better. So the ROI on investing in all of this is there not only in you actually seeing the treatment, but also in your revenue cycle management. So, and then also when the insurance company denies something, it does sometimes erode trust with our patients. They don't understand. They think, oh, is the doctor trying to scam me or whatever? So let's bring it full force and take care of our patients. Here we're looking at the same patient, Ken, and then we'll go in closer. Here I'm just showing you simply that you can see some of the highlights that are showing up. It's circling an overhang, and it's allowing you to make a decision. This same patient, the doctor placed the implant, and they were really excited about placing that implant. So they let me know, like, that, I celebrate all of our doctors' successes. I'm proud of them. And they did a great job. But when I pulled up the x-ray to say, oh my God, this is so cool, I'm so excited to see it, I was like, wait a minute, I don't see anything in the notes about the lesion on 27. Now, did your assistant turn off the AI when you came into the room? Did anybody look at the x-ray? Like, if you can't miss this. It's really hard to miss. So you have to stop and look at it. But the AI is going to support you, and it's there. And there's, no point of doing any of this if you don't look at it. Like, don't take the x-rays and not look at them. But when you have this big blue glob, there's also a great opportunity for you as a dental assistant to say, hey, because I know you don't want to overstep, but say, hey, patient, the AI is reading something here. And I want to have the doctor come in and confirm what's going on with that tooth. Tell me. Now, I am concerned. Are you noticing any pain or discomfort over there that I can share with the doctor? Because now when the doctor comes in, you have the opportunity to overhear psychology and share with the doctor, hi, Sarah here, we noticed this lesion. We want you to take a look at it. It's showing up on the x-rays, but they also are noticing that they, felt a little discomfort when chewing, and they just thought it was because of, losing the other tooth, but maybe you can take a look at it. Okay, another example, and I promise I'll keep going here and get through this. This was my mom, and the doctor was super experienced, Koi's mentor. Like, we didn't have AI at the time when this was done, but they missed the apical lucency, and my mom lives 2 hours away from me and was waking up in the night with pain, but she also didn't want to be a burden on us and on the practice. So, and full disclosure, I wasn't able to take care of my mom because of my spine issues. So, I referred her to another doctor in my practice, and they, took care of her, and I trusted the process. I didn't even go and look and be controlling like I normally am. And my mom was leaving for vacation. So I had to emergency get her to come down from the mountains, get the tooth removed, like get everything situated. But there's obviously a lesion there on the furcation and the apices of number 18. So we have to ask ourselves, is failure to diagnose or misdiagnosis is a malpractice? Technically, yes. A failure to diagnose or a misdiagnosis can be a form of malpractice, and this is a common form when the doctor fails to take the proper steps to diagnose a medical condition properly and correctly. And these are 3 cases right here where periodontal disease was failed and the patient was awarded. Now, one of those cases, the patient refused treatment and still won their case. So the doctor actually recommended periodontal therapy, and the patient won their case. So, Google those if you want, but remember, jurors are patient friendly. They're not provider friendly. So what do we want to record at our visits? We want to make sure we're doing at least 1 intraoral photo. We're going to at least do bite wings and PAs annually. And yes, a full mouth series every 3 to 5 years, depending on risk. Now, when you see a new patient, think about what everyone is going to design it different in their practice. What do you want to do? Do you want to do your x-rays because you're doing those annually? Will you perio chart again at 6 months and then alternate them? Or are you going to do your perio chart and x-rays every year and then you do an intraoral scan? You figure it out as a team what works best for you, but make sure you create a system and a cadence for that. And if you're incorporating intraoral scanning at, annual visits, that can show a big picture of decay, fractures, wear, all this. It's just more tools to have in your armamentarium and a way for patients to, process this. So if you haven't integrated AI into your practice, it's time. Our practice, we use Pearl because it's integrated right onto the SOTA platform, and that was really important to me. I did not want my team to have to open up another window. That was our original, reason for going forward that way. And what is also really great about the AI tools is that your patients can now visualize. You can do the tooth colors and show your patient the calculus, show them the decay. This doesn't look like tools. This looks like a pretty watercolor. So you can show them and say, are you open to seeing what I see? I'd love to share with you so we can decide together what's going on and how to move forward with treatment. And I will often say, I feel like sometimes even, and they're going to probably not like that I say this, but like it even underdiagnoses the bone loss more than overdiagnose it, because it measures what it sees in the bone. It doesn't always see when you've got that bone loss that sort of angles towards you. So if it's showing those yellow or red lines, it's there. So for what it's worth, if you don't create the opportunity for your patients to visualize and see their x-rays, they're gonna think of you like this guy does.
This is what dentists do. They take an x-ray of your mouth. Usually first x-ray, they don't get what they need. Already you're panicking. You're like, what? X-ray is not working. They want you in this state. They want you to be like this. Second or third x-ray they put in front of you. You can't even tell what's in the x-ray. They know you can't tell. They still consult you. Like suddenly you are the senior dentist. My dentist, he put the x-ray in front of me. He's like, can you see this over here? Nothing I could see, nothing. I didn't know those are my teeth. He could have said it's your luggage x-ray from the airport. We found a tooth in it. I would have believed it. When your eyes don't even know what plane to focus on, like I was seeing through the x-ray. There was another dentist working on the other side. I was clueless. I want to forget dental checkup. I need an eye checkup. What is...
So these images are great for conversation, and using that color change and using the AI is really going to support your diagnosis, and then therefore you can move on in the treatment plan. Also, highly encourage taking at least one intraoral photo at every recare. And here's the language that I use, and you've heard me say it already in this evening. Are you open to seeing what I see? Now make sure you ask, because some people will come in, you might have a strong, a DISC, a D personality who's going to come in and say, I just want to know what I need to do, how much it's going to cost, let's get it scheduled. I've had patients like that who come in and they literally sit down in the chair and they need a crown in every single tooth and they don't care how much it costs. They just want to get it figured out. And okay, let's do that. But for the majority of our patients, bringing them into the conversation like we talked about and pacing with them is really important. So I ask, are you open to seeing what I see? May I show you this bleeding is not normal? Tell me what you see. Like if you put a picture up, I won't do this with an x-ray because it feels a little bit like you're shaming them or confusing them. But when it comes to this, like an intraoral photo, I will ask them, tell me what you see. And then we're going to celebrate. We're going to say, great news. We have a solution for this. It's not too far gone. We can save these teeth. We can do periodontal therapy. We can put a crown on this. Guess what? You have a lot of bone. We can do an implant. You're going to still be able to chew. Think about how that sounds versus where if you're like, oh, you're going to need a crown. let's turn it into like a more positive and exciting part. These pictures are powerful. The permission statements are really, really important. I ask them, are you open to seeing these photos so we can make your plan together? Because if one person shows up as too much of an expert in a conversation also, the other can feel diminished. So you want to meet your patients where they are, take out any hierarchy, and remember, do you enjoy being told what to do? I mean, everything my parents have told me in my adult life, you know, I did the opposite. So these people, when you put a picture up like this, they're going to pick themselves apart. You're allowed to compliment the good. You know, this person, I would say when I showed them, obviously this person's in a rough spot. But I showed her pictures and I worked to collaborate with her. And I said, you've got these bottom front teeth that are really, really healthy. Like they were great. You've got some cavities up here and there's some gum disease. Great news is I can fix that for you if we work together. So tell me, do you like options or do you prefer I just create the most beneficial health care plan for you? What would you like? Because I'm here to help you. Think about how that feels. And using these pictures, somebody once said to me, a picture's worth 1,000 words and thousands of dollars. Well, it's kind of true. You put a picture like this up on the screen where it's real and it's them and they're like, whoa, what's that pink thing? What's that black stuff? And they have their own response to it. And those two bottom teeth, they're a little bit crooked. Can I fix that? So again, I work with a DSLR primarily for all of my work, but my hygienists have an eye special because it's less intimidating and easy to use. And my hygienists are all taking DSLR photos at the comp exams. Also remember, do not store your photos on a server where they can be deleted. You want them in your software. Again, before we had SOTA, we were storing our DSLR photos in just a server folder, a drive. And really crummy story is I had a patient come in. She was unhappy with our previous dentist. We did a smile design for her because he had done some front teeth on the CEREC and she didn't like them. She said they felt bulky. I don't know what happened, but she left him in the middle of care and came to me and said, I want you to do my teeth or I'm going to LA. So I was like, this is easy. I can fix this. We fixed it. And then after she was happy, she decided to, sue her previous dentist. So she came in and asked for her photos. Well, my teammate drag and dropped the photos instead of copy and pasting photos onto a file. So now I didn't have any of the pictures of this case. And then come 2 years later, the Attorney General for Colorado calls me and was like, hey, this is a case that we want to ask you some questions about since you saw the patient later and she's doing her old dentist, blah, blah, blah. And can you send us all her records again? I'm like, I didn't have the pictures anymore. And can you imagine going up to the Colorado Attorney General and being like, I'm sorry, I don't have the records. My assistant deleted them. That sucks. So now, I tell everybody, put it in SOTA. There's unlimited storage. Just put it in there. And that way you always have a copy. Nothing can be deleted out of there. Do you want to be a superior doctor? You got to take the x-rays and the images. You prevent the disease. Superior doctors prevent the disease. Mediocre doctors, they might treat the disease before it's evident. And inferior doctors are going to treat the full-blown disease. They're going to wait. And I want to be proactive with my patients and give them these options. And so why are we here today? And why have I, mentioned that we chose SOTA and Pearl, who have, graciously sponsored this webinar? Primarily the integration with our practice management software was important. It's easy to integrate. There's the architecture and accessibility. Like I love that I can be at my desk while my teammate is taking pictures in the office and I start developing a treatment. I love that I can access them from home so that when my patient calls with an emergency, I can pull up the x-ray. Hopefully they don't have a lot of emergencies because we've been proactive, but I love that I don't have to have a server and backups and I'm not losing pictures. So that's an important thing. It's awesome to also be able to share these images with your patients. And, you know, you've got 3D imaging capabilities, you've got the Pearl analytics. Like this is all huge to be able to integrate with your practices. And this is scalable. So we have 40 locations. We needed scalable. Also, every week I get a dashboard from Pearl on our practices. And if you look at this data in here, if you think of even treating half of these incipient lesions with Curodont, think about what that does for your patient to keep them from having to get a filling, or for your practice, or for your hygiene revenue, because we all know that wages have increased and compensation has not. So hygienists can do Curodont. It's great. Think about half of the decay on this chart could be an indirect or a direct restoration, like even just half of it. You can also generate reports on your overdue hygiene. I love the daily huddle. The daily huddle is huge. The daily huddle is going to show, like, here's your treatment today. What's treatment that you have on your schedule, but what's unscheduled treatment that's in your chart, but is not diagnosed. And then there's also the predicted stuff that Pearl has detected, maybe a pathology on a radiograph from the last, 18 months, but no treatment code. I also used to have to manually audit our charts to make sure that the x-rays were being taken annually. And this is just a 6 months year over year. I want you to see from the lower line is before our SOTA Pearl. And then the next two lines are the growth of production from just radiograph codes over a 6 month period. So I did the first half of the year, 3 years in a row, and that's after implementing our morning huddle. So it pays for itself. And so if you're worried about that investment, no, I mean, look at in my practice, we have 12 treatment rooms. So, 5 hygienists or 6 hygienists every day, but that in 6 months, that was almost $300,000 of revenue of x-ray growth. So look at that. Remember, the more you see, the more you know, the more you do. And the more you do, and the more proactive you are, the better your patient experience is. They don't want to come back. They don't want to get numb a second time in the same area. They don't want to have pain on the weekend. They don't want to be almost missing a vacation because of an emergency. And I got really close on time. I want to say thank you again to SOTA and Pearl for making this evening a possibility. I'm Jen. I'm open to questions. If you think of something afterwards, my website is currently down, but you can reach out to me on Instagram, Derse CDS. You can direct message there. I'll do my best to answer. And again, thank you, SOTA and Pearl, for making this an opportunity now.
Excellent. Thank you so much, Dr. Derse. We have already a comment that says, amazing presentation. So thank you so much for spending time with us. We're going to open this up for questions. I'm going to check in the chat here. One of the questions was, how do you get everybody on board to using Pearl AI? And they seem to have struggled with some providers not wanting to use it consistently. So what are your thoughts on that?
That's a really good question. So I would ask your doctor that doesn't want to use it, if they want to send a really important email and turn off their spell check. So, and I'm like, I'm keeping that one. I'm taking that one and running with it. I mean, listen, when I do my email, like, of course, like Aspire Dental, Outlook still can't figure out ESPIRE. They want to change it to an A every time. But then I type so fast and I'm hurrying. There's a lot of typos and I always have to use my spell check and use it. So if you think about that, like if your doctor doesn't want to, use AI, maybe they need to reframe it. Get them into a space where they are going, okay, this is an opportunity for me to make the X-ray and the AI, the hitman, and I get to be the hero. So that would be my hypothesis. And I hope that answers the question. And please, ask more if that helps.
The other thing, if I could interject real quick, is if it's not embedded into the imaging software, it's not as easily accessible, and so that's a key point as well. Is it's there, it's part of, you're not having to flip to another window or what have you. So that's an important aspect as well.
That's a great point,
That's
Scott.
that's huge.
I mean, don't you think too, Dr. Derse, as fast as your team runs through radiograph review and case presentation with the patient, to have it inside of your imaging system is really the best way to, in essence, avoid change management, right? It's already there. So I think that's the beauty of having Pearl integrated into SOTA Cloud. And I'd love your input on that. And before you answer that, the other part that I think is super valuable this day and age in dentistry is to be able to call your patient right away if there's an emergency, and you can look up their x-ray right on your phone, right from your living room. I mean, that's a big win as well as far as taking patient care to the next level. So kind of walk us through that a little bit.
I'm sorry, can you just say that one more time?
I was just
No.
wondering about, like, imagine having it on automatically inside of SOTA Cloud, right? So you just have the AI turned on. You don't have to go to a separate screen. That seems to be the best way to
Yes.
have your team be able to know that this is really flawless and there's no change management, right? You're already in your imaging system. So that
It's so important to not have to train that extra step. Think about our muscle memory. Our brains are like, if you told somebody to walk different or to hold their Explorer a different way, that's hard to do. So having it right in the software where it pops up and it just screams at you is incredibly key. And then let's just be real. Assistants turnover, hygienist turnover. I'd rather them go, oh, what's this big blue blob? Than, you know, have to be like, oh, you've got to open up another window. And think about your practice, your room. If you've got your, like for us, we have CareSec. So we've got CareSec open and we have our SOTA window. And it's all integrated. Like, so I can pull up CareSec, I push on the button, the SOTA opens up and the Pearl AA is right on top of it. I couldn't create a system across 40 locations and 80 doctors if I didn't have that.
Love it. And I think another question here, and before we jump in through these questions, which we would love for you to stay in, and we're going to share the CE code in just a second. We're going to talk about CBCT here in just a minute, but these two QR codes now, before I put up the CE code, is for you to really just kind of pick the best time for you to spend some time with your team, getting an introduction into, what is Pearl AI and how you can use that directly in SOTA Cloud. So I'll keep this up for a few more minutes as we go through questions, but I will be putting up the CE QR code in just a second. I think there's a question about CBCT. I'll take it on the Pearl side, and then Scott, if you have anything else to add, love for you to do that. But we are now moving into showing real-time AI on CBCT scans. Right now, it's just anatomy, pathology, some airway stuff, TMD, being able to really kind of assist with implant placement. You can see like the nasal floor, as well as the IA nerve. So that's been a big win, and excited to share the first ones to get FDA approval for AI on CBCTs. But I think that's going to be a game changer as we move into 2026 and teams that are using that almost as standard of care these days. Scott, anything you want to add to that at all?
So we recently incorporated 3D capabilities within SOTA Cloud. We're building out some of the integrations with the various platforms and so forth as far as a hardware, from a hardware standpoint. But yeah, you can store CBCTs within SOTA Cloud alongside your 2D images. You can share them with referrals or with a lab or what have you. So gives you those capabilities. That's a big pain point, is how do I get my CBCT over to another office? So we've helped solve that, and then we've got our own viewer that you can pull up on any type of device and do manipulations and so forth as well.
Excellent. And I think one of the other questions is how fast does the AI actually show up? So walk us through kind of a hygiene doctor event, Dr. Derse, where your hygienist just took the x-rays you recommended. How long does it take for you to pop in, maybe look at those in your office, maybe before you go into a patient? Tell us about that.
Well, the AI shows up immediately. It's just a really fast process. It's just like if you were doing your own normal process without the AI. But what I do think it does help you speed up is your ability to read the x-rays. Because if you think about when you're trying to like lean in and look at things and highlight stuff and invert the images, it's basically putting the colors on there for you. So then, and then you just click it off and go, oh yeah, there really is a black hole right there. And then you click it back on and you click it off again. You're like, yep, that's there. And so there's like, you can see, you know, even that picture up there, it just, the one on the bottom is what it looks like immediately. If you want those tooth colors that you see on the top, that you click on it to turn it on. But when you snap the x-ray, it looks just like that bottom image right there. So
Yeah,
it's easy to integrate. That's, we try to make things as easy and as possible. It's a better experience that way.
so we have a question for you about somebody asked this question, which is funny because I remember having this happen in my practice, was really they're trying to ask you, what do you discuss first on the radiograph, and how do you prevent the doctor from doing hour-long discussions? It's a very thorough
This is
doctor.
so good. This is so good. You know, it's funny because doctors do love to hear themselves explain. And I remember sitting outside the room of a doctor once going, he was telling this patient he was going to do a crown on number 8. And just a little note, if you're going to do ceramic on one tooth, the way the light refracts, you're all, even if you get a perfect shade mask, it's always good to do things in pairs. But he was explaining the difference between Emax and zirconia. And I thought, what in the literal hell? Why are you going into that with your patient? Like, does it help you feel smart? Patients don't care. They care that it looks all right. Tell them it's going to look great. It's going to feel good. But really, if your doctor is spending that much time explaining, listen, people trust you. The more you know about them, the more you know. So, you know, they say that we were created with 2 ears, 1 mouth, use it, you know, proportionally. I coach doctors to ask questions because you can ask lots of questions that makes your patient feel heard. Like, so tell me, do you have pain here? Do you see this lesion? Like, what has been your experience with a crown in the past? Ask enough questions and then you say, well, you've shared all of this with me. My recommendation is to put a new crown on it. And they feel so heard. You don't have to explain away like the difference of the ceramic. I tell the patient, I don't even explain tooth by tooth. Like patients, you know, when I was right out of school, I'd say, oh, you need a crown on this tooth, this tooth, this tooth. And then you need a filling over here and a filling over there. And it was probably chaos to these poor people. And then as I matured and I learned how to interview, at the end I'd say, do you want me to just make your treatment plan? You need a couple crowns, couple fillings, and then we'll do some aligner therapy, and you should be good to go. Is there anything I missed? Anything you want me to cover that you hadn't? And will you promise me that if I give you a plan that you don't feel comfortable with in any way, shape, or form, you'll call me back in and we can collaborate on it together because I really want to pace with you and do this in a way that makes sense for you.
I love that.
I mean,
so
that's just, yeah.
When they know they
So
can
no
talk to
more
you about it. Yes, that's huge. And I think what we've heard too is, you know, you're not standing in front of an image for so long showing them black and white because they now see color, they see a cavity, and you get to be the hero if, you know, your hygienist says, hey, there's an area there that they said we could watch and wasn't sure, and you come in as a doctor and say, oh, we're going to keep an eye on these. We're just going to do this bigger one. We have found really from teams using AI is there's less time that we're talking and more time, to your point, that we're listening. And that's really the foundation of building that relationship, building trust is we have time to sit back and answer their questions while we're in the practice because we're not showing shades of gray in the enamel that are scary, but in the pulp, it's fine, right? I mean, it's amazing that 64% of patients have no idea what you're showing them. So I think that's really valuable feedback too. And I really appreciated how you walked through all of the basic standards of what we should be doing to take care of our patients. Those simple x-rays we sometimes forget. And I've not seen that statistic before, but it doesn't surprise me that, you know, the ROI on just taking more radiographs alone is one thing, but let's take a step back and think about that's much better care for our patients, right? That we're taking the x-rays we need more consistently so we can find things earlier. They're less invasive, less expensive. And that's what I have found to be really the foundation for scalable growth in a practice. So
being proactive.
Yes.
And, can I add to your comment?
Yeah.
Sorry. You said the word watch. And so watch is like not allowed if you're around me.
Yes.
I want to point out, like, whenever I'm having this conversation with a patient, like if I see, you know, an E1 or E2 lesion, I am never actually watching it. I will tell a patient, there is a lesion here, and you're lucky that it's currently just in your outer layer, the enamel. It's not in that second layer where it spreads faster. This is kind of like a skin cancer analogy. But if you are in just the enamel, I'm going to treat that. I'm going to treat it with Curodont and Carry-Free toothpaste, which is a calcium phosphate toothpaste. And I'm going to treat that with your home care and something here and fluoride. And then I want to see you back. And as long as you take good care of this, this should work. But it's still a tooth. And if you go home and you drink a bunch of soda, you know, the acid could break it down and it's still a real tooth. So, you know, having that conversation more of like, I'm going to treat it this way and I'm not watching anything is something I'd highly recommend integrating into your vocab.
Yes, it's good you said that too. One of the doctors, one of the office managers asked a question on the last webinar. She's like, what do you do when your doctor's a watchosaurus? I was like, that's really funny. But we're really
I'm stealing that.
right? It's great because it's true. And before we were really focusing on minimally invasive dentistry as well as, you know, remineralizing, that really was the only course of action. So I think having the highlight from a light pink lesion that's enamel only into a darker pink lesion really allows you to have those conversations with your patients on focusing on incipient areas of concern that could be remineralized versus those more progressed lesions. So I just wanted to wrap this up and thank you guys for staying for so long with us this evening and share with you a couple things. Again, here's the CE code. You will all have this recording sent to you. Love for you to spend some time with us and bring your team along for a quick overview, you know, a 15, 20-minute demo at a time that works for you. And I wanted to send a special heartfelt thanks for Dr. Derse putting this all together and sharing those images from your practice, and really just kind of your message is so incredible. Hopefully that's resonating with a lot of clinicians this evening. We couldn't have done this webinar without our SOTA team. We so appreciate our partnership here. I will let Scott wrap us up, and then Dr. Derse, if you want to finish out the last statement.
All right, thank you, Sheila. Really appreciate Pearl allowing us to be a part of this, and appreciate all the participants. We would love as well to have an opportunity to show you why SOTA Cloud's the fastest growing imaging software on the market, and we appreciate everybody's time. Thank you.
Thank you all for letting me ramble and rant for the evening, because I get amped off of this kind of thing and sharing everything, like, you know, the amount of time that I've devoted to dentistry, and I can't practice anymore because of spine surgeries and some problems there, but I still live and breathe and love this profession. And there's so much that you get to do now. Like, biomechanics has changed drastically. And from the technology that we have here to our ceramics to the composites that we have. So you're in a really cool era of dentistry. And so enjoy it, but, you know, get the technology. It's worth it.
Excellent. And one more person had a question about CE, so I will leave that up here. one more time. There is a little code at the bottom. You know, they make it so easy. It's only 25 characters. But right here, the WTW 6TYSE, that will be your code. Again, that's my email. If you have any questions, feel free to reach out. And again, thank you all for joining us. Have a wonderful evening. And don't forget to look at our website, hellopearl.com, for more webinars. We'd love to have you join us in the near future. And have a wonderful evening, everyone. Bye-bye.